Hello everyone, how are you all? So today we will be discussing gestational trophoblastic diseases. This will include the molar pregnancy, the gestational trophoblastic neoplasia, everything. Okay, so now let's study the gestational trophoblastic diseases. Okay, so first of all, first and foremost is the clinical scenario which they give to all of you people to diagnose it. So the most common clinical scenario which practically the patient comes and which they give you in question is that the early pregnancy patient around 12 to 18 weeks, around 12 to 18 weeks patient comes, around 12 to 18 weeks patient comes with bleeding. Early pregnancy patient, it comes with bleeding and it is snowstorm. So and the patient we what we suspect when the early pregnancy patient comes with bleeding, what we suspect it is abortion, because if it is ectopic, then the patient will also come with pain, right? Ectopic pain is the most persisting symptom. So we will suspect that it is that this patient is surely having abortion. Okay, is either it can be threatened, inevitable, or both. So we will examine the patient, and we will send the patient for the ultrasound to confirm what the type of abortion is. And on the ultrasound, if the radiologist writes snowstorm appearance, then it is a case of molar pregnancy. Okay, molar pregnancy. You all have marked the correct answer. Most, when I'm saying all have marked, it means more than 50% the result has I have got the result. Okay, in some questions you have marked 70-80% also, students have marked it correct. Okay, now let's see where you marked it wrong and how you marked it wrong. We will focus on that part. Okay, so early pregnancy patient with bleeding with a suspicion of abortion, we send the patient to get the ultrasound done after the examination, and on examination we get a snowstorm appearance. The diagnosis is molar pregnancy. Okay, the other scenario which is, though we don't get, because I have seen, I think in my 10 years of clinical practice I have seen at least uh, 30-40 cases, because I am a North Indian, so here the cases are very less. So I have seen 30-40 cases, and none of those patients they come with hyperemesis. Means, and they one patient come with increased fundal height, none of the patient comes with fundal height. So this is very rare, but yeah, do ask you sometimes rare things. And why it is that? Because in molar pregnancies increased HCG is there, so they want you to know the basic, that increased HCG means increased vomiting, increased HCG means, because HCG stimulates LH, so increased HCG means increase thyrotoxicosis, because HCG also stimulates TSH, right? And plus here there are sometimes on the ultrasound we also see theca lutein cyst, because HCG simulates LH. Okay, because HCG simulates LH also, right? So it start function this HCG starts functioning the function of LH. It starts forming cysts in the ovary, which are known as theca lutein cysts. Theca cells, they get uh, stimulated and they start forming the theca lutein cyst. Okay, so they, with asking all these things, they just want to ask you the basics, that HCG is the one which causes vomiting in normally also. So when there is hyperemesis, they want to ask you that when there is hyper HCG is in the molar pregnancy, and preeclampsia is there because some problems of trophoblasts are occurring, right? Some problem of trophoblasts is occurring. Now that normal that we studied in hypertension of pregnancy, the normal spiral arterioles were being getting invaded by the extravillous trophoblast, and the tunica media was removed. Now that will not happen in just like in preeclampsia it doesn't happen and lead to vasospasm, and here in the molar pregnancy, because problem here is in the trophoblast, so now that extra villus trophoblast will not be able to invade and remove that tunica media, because trophoblast here is a problem. It is a trophoblastic diseases. So now there will be pre-onset preeclampsia, early onset preeclampsia. Okay, so here they just these things they don't come in clinical practice, but by asking these they just want to know your basics, that you know or not ki HCG causes vomiting. When there is increased HCG, then there will be increased vomiting, and when the problem in molar pregnancy is with the problem with the trophoblast, so there is early onset preeclampsia, and the HCG also simulates thyroid, so patient do come with thyrotoxicosis, and there are thecal urine cysts because HCG also simulates its HCG also simulates LH. Okay, okay. So now let's move to the next slide. Now here basically though this topic has been you have read it many times. I don't know why don't you get it, these questions you get it correct. Okay, the questions which I posted yesterday in telegram, less than 50% of you are not marking them correct. Please see here, I will tell you what is the basic etiology so that you can easily mark it when you are doing the question. Okay, so first of all, you know the what is the basic etiology behind the molar pregnancy, why some females they form molar pregnancy and most of the females they form normal pregnancy. Why is it so? You know that normally one sperm fertilize, normally one sperm fertilize, but what will happen if two sperms will fertilize? So problem is that the two sperms have fertilized here in the molar pregnancy. The problem is that the two sperms have fertilized the ovum. Okay, now when two sperms have fertilized the ovum, now this abnormal fertilization results in molar pregnancy. Let's see how it results. But basically, you will remember that two sperms they fertilize the ovum. Now, if that ova is empty, it means that ova does not have the nucleus. Now, the main fault is not only on the male part, the two sperms are getting fertilized. Okay, once we will take the break here, and I need to ask you why only one sperm fertilized normally. So you have to write in the comment section why only one sperm fertilize is normally. And there is a mechanism to prevent other sperms to fertilize. That mechanism fails here and molar pregnancy is a result. What is that mechanism which prevent other sperms to fertilize? Okay, okay. So now here I want to tell you that what if two sperms they fertilize and the ova does not has its own nucleus, and ova does not has its own nucleus. If two sperms fertilize and ova does not has its nucleus, see what will be the, see here I haven't made any nucleus and two sperms they are coming and fertilizing this empty ova. Empty ova means the ova which doesn't have the nucleus, then diploid, then first of all what will be the genotype? Because the ova was empty, because the ova was empty and two sperms fertilized, so one sperm is n and another second sperm is n plus n, two sperm, so 2n. Ova was empty, so 2n. Now now the what is formed is known as complete mole. Okay, now if the ova was nucleated, if the ova was nucleated, see this ova is nucleated, I have drawn here a nucleus, let me highlight it. Okay, and now these two sperms are fertilizing this nucleated ova. Now because two sperms means diploid, n plus n diploid, and the nucleus of the ova also, now it is triploid. Okay, now what is form is the Partial mole. Partial mole. Now why we say it partial? Because this is known as partial mole, because here a fetus is also formed. No doubt it is an anomalous fetus, but fetus is also formed. See, when the mother nucleus is there, then the fetus will be formed. When it is, the nucleus will is was empty, ova was empty, no nucleus was there, then you have seen that at only complete mole was formed, fetus was not formed, not a single trace of fetus was formed. Okay, so once they tell you what is the genotype of complete mole, you know that complete means no fetus. No fetus means no female mother nucleus. No mother nucleus means only two sperms, they go and fertilize that empty ova, so it is diploid. Now, now in the partial mole, fetus was there. Fetus was there means the mother nucleus was there. Mother nucleus is necessary to form the fetus. Okay, so it means mother nucleus was there. Partial mole means fetus is there along with that villi problem, hydropic villi. Fetus is there. Fetus is there, matlab mother nucleus was there. Mother nucleus plus those two sperms, triploid. Again and again, I will tell you till you get my answers in the telegram correct. Okay, complete mole, no fetus. Mother nucleus empty. Mother nucleus empty, it means only two sperms genotype. Only two sperms genotype. Two sperms genotype means it is diploid. It is diploid. It is diploid. Okay, partial mole means fetus is there along with that hydropic villi, fetus is also formed. Fetus is formed means mother nucleus was there. Mother nucleus and plus those two sperms, that makes triploid. 69. Okay, now I hope you learn it. So this is diploid, 46, and this is triploid, 69. And now more are the X chromosomes. Sperm can have X chromosome, and why? I think you know this concept. More are the X chromosome, more are the chances of molar pregnancy. Okay, more are the X chromosome, more are the chances of molar pregnancy. Now here the most of them will have the genotype 46XX, and here the most of common genotype in partial mole will be 69 triple X. Okay, one more thing was left, that the all the genotype, all the genes in this 46XX are paternal, because ova was empty. Complete mole means no fetus, only hydropic villi, only those two sperms nucleus are there, and sperms are paternal. So 46XI, whole this 46XX is paternal. Please don't mark these things wrong. These can be asked in exam. No doubt clinical scenarios are asked, and you all are very clear on the clinical scenarios, but please don't mark these things also wrong. These can be asked. These are basics of molar pregnancy. Complete mole, no fetus, only hydropic villi, no fetus, empty ova. Empty ova means only those two sperms genotypes. Two sperms genotypes means diploid and both paternal. More are the X chromosome, more are the chances of molar pregnancy. So most common genotype will be 46XX in the case of complete mole. In the partial mole, speak with me. In the partial mole, what will happen? Fetus will be there, fetus is there, mother nucleus was there, mother nucleus was there, mother nucleus and two those sperm nucleus, triploidy. Triploidy means 69, both maternal and paternal. Okay. Okay, next time please don't do it wrong. Okay. Now let us see. Now let us see what this hydropic villi means. Now abnormal, because two sperms have fertilized that ova, whether it is empty or nucleated, whatever. So when two sperms have been fertilized, so there is abnormal embryo is formed. Abnormal embryo will have abnormal trophoblast. Abnormal embryo will have abnormal trophoblast. As a result, there will be abnormal villi. Now these villi, they get the water inside them. What is the property of these villi? These villi, they get water inside, they become cystic, and then they go undergo hydropic degeneration. Okay. And now these cyst or hydropic degeneration cyst, they are seen on the ultrasound as snowstorm appearance. You can see, I will show you here. See, these abnormal cysts, these are the cysts. Okay. See, these are the cysts. So those villi, they engulf the water inside them, and after some time they undergo degeneration. So that are known as hydropic villi. Villi, they undergo degeneration. So these are the what are these red color marked areas which I have marked red? These are nothing but the villi. They have get inside them water and they have become cystic. That is the black part, and rest white part is, the black part is the fluid inside them. The black part is the fluid inside them. See, there are small, big villi, every type of villi depending on the amount of the water they have imbibed or engulfed in them. See, these small. So either they are small cyst or large cyst. Who is forming this cyst? Villi, they are getting water engulfed in them, absorbed in them, and these villi which have absorbed water, they look like cyst. So they look like black dots on the ultrasound with the white tissue in between. Okay. So these are villi which are giving the snowstorm appearance. Okay. Okay, now let us see the difference between the let us see the difference between the partial mole and complete mole. Okay, complete mole is also known as hydrated form mole. It is also known as vesicular mole. Vesicles, cyst vesicles. Okay, cyst vesicular mole. ठीक है. So now you know that partial mole is triploid because in this fetus is formed, and it is triploid 69XX, and in complete mole empty ova was there, no fetus was formed, only hydropic villi. So we see, so see, this is the thing. In partial mole, on ultrasound we get fetus plus hydropic villi. So so hmm, so so you can say that, so this is not called snowstorm appearance. Partial mole ultrasound appearance is not called snowstorm appearance because on in the uterus, somewhere there are hydropic villi, somewhere there are fetus. So this simulates more as a missed abortion, right? A fetus who has expired, right? So it looks like mixed abortion. Okay. And the complete mole, it looks like more so, look like the snowstorm appearance. So in the when they give you the image of snowstorm appearance in the exam, they write their two choices: partial mole, complete mole. So you in the exam get confused. Yes, a hydropic villi is formed in both. Okay, so snowstorm appearance is a name given only and only to the complete mole. It is not given the name to the partial mole, because in there the fetus is there. So the whole uterus is not filled with villi. So you can see the fetus. So complete snowstorm appearance is not there. So snowstorm appearance name is restricted only for the complete mole. Okay, where the whole uterus is filled with snow. Okay, not for the partial mole. So partial mole has space of in a space uterus, and in a space there is in a space there is fetus, and in a space there is hydropic villi. So both are seen. So it stimulates more as missed abortion. Okay. Mm. And this partial mole, it has very less. Earlier when we used to study, we used to say that there is no malignant potential, but now one or two cases have been reported with malignant potential, so we say decreased malignant potential. So if there is, it is a partial mole, then high chances are there that this case is not going to progress to malignant potential. Okay, and but complete mole has 20% chances of forming the uh, going into malignancy. One last thing which is left for partial and complete mole, though it has not been asked in FMG exam, but it can be asked. P57 and KIP2 staining, they stain positive. Okay, they stain positive, and whereas in complete mole it is negative. Again, these stain positive only when mother nucleus is there. So you know now in partial mole fetus is there. In a similar way, P57 and KIP2 also stain positive, because these are the genes of the mother nucleus, not on the paternal nucleus. So when they are there, then these stainings are also positive. Okay, sometimes we do forget, sometimes we do forget that sometimes we do forget sometimes the pathologist is not able to differentiate. Okay, or the whether it is partial mole, complete mole. In that case, is the patient come to us with snowstorm appearance, then we did suction evacuation, then we send those villi to the for the histopath. Now it can be possible that the technician didn't put the fetus inside. Okay, somewhat. So we want a confirmatory that whether this is partial or complete. Okay, so then we undergo these stainings, P57 and KIP2 staining. If they are positive, it means the mother nucleus is there. Mother nucleus is there, it means it is a partial mole. Okay, and if it's negative, then it is a complete mole. That the high chances of getting into malignant soon. So these are the this is a question. See, main question which come into your exam is the snowstorm appearance is seen in. Now you all know that snowstorm appearance is seen in a molar pregnancy, but they confuse you with these options. ठीक है, just tell me whether snowstorm appearance is seen in choriocarcinoma, whether the snowstorm appearance is seen in choriocarcinoma. No, choriocarcinoma is malignancy of the complete mole. So choriocarcinoma is the malignancy of the complete mole. So in choriocarcinoma there will be in the choriocarcinoma there is no snowstorm appearance. Snowstorm appearance, choriocarcinoma is a malignancy, it is not the complete mole pregnancy. First option in the exam it is given snowstorm appearance is seen in, and choriocarcinoma. And some of you mark it please, in choriocarcinoma no mole no is seen. Okay, Okay. Next is in the partial mole. Again, no, I already explained you. In partial mole, the whole uterus is not filled with hydropic villi. What is snowstorm appearance? What is snowstorm appearance? Snowstorm appearance is nothing but hydropic villi in the uterus. In partial mole, half of the uterus, in the half of the uterus there is fetus, and in half of the uterus there is hydropic villi. So in partial mole, again you are not going to mark. Second option there which is given is partial mole. Again in partial mole, as whole uterus is not filled with hydropic villi, so you are not going to mark partial mole has snowstorm appearance. Next option which is given in invasive villi. Invasive mole is again a, it is not a complete mole, other name. ओके, कंप्लीट मोल का दूसरा नाम नहीं है इन्वेसिव मोल. इन्वेसिव मोल इज अ कैंसर, इज अ नियोप्लेजिया. Okay, so it is a form of neoplasia. So again you are not going to mark that snowstorm appearance we see in invasive mole. Then sometimes they also give you placental site trophoblastic tumor. So again you are not going to mark it correct. Okay, snowstorm appearance is seen in hydrated mole, which is the another name for complete mole, which is another name for vesicular mole. In this, all these three options you will mark are yes, snowstorm appearance is seen. ठीक है, I only change options when I put their H mole and this other options. 60% answer were correct. When I put their choriocarcinoma partial mole, again the result fell to 30%. Please clear it now. Snowstorm appearance is not seen in malignancies, in neoplasia. Snowstorm appearance is seen in complete molar pregnancy, not in partial mole pregnancy also. Okay? Treatment. What is the treatment of it? Now see, it is a molar pregnancy. Its treatment is not DNC. Its treatment is not. Its treatment is not. You can say we have to give prostaglandins to the patient. Only one treatment is there: suction and evacuation. This is a question of AIMS my 2020. It can be asked. It is a highly susceptible question. Now you, they know that you are answering the snowstorm appearance correct in the complete mole, vesicular mole and H mole. Now they will ask you this: what is the treatment of H mole, complete mole, partial mole, vesicular mole? What is its treatment? ठीक है, so their treatment is not DNC. You know, you are not going to mark DNC. It is suction evacuation. We cannot do DNC. Lot of vesicles are there, they have to be removed fastly, they have to be removed with vacuum. Suction means a vacuum is connected there. Okay, if we are going to remove it by manually, by curate, then lot of bleeding will occur, hell will happen. So you are going not to mark that DNC can remove. No, we have to use vacuum pressure so that they can be removed fastly and bleeding is less. Okay, I have seen cases getting complicated it with bleeding. Molar pregnancy, the patient get complicated due to bleeding, and I have seen, I think, two cases they expired due to the bleeding, massive bleeding during the DNC, sorry, during the evacuation. See, after evacuation the patient are at the risk of bleeding. What will happen if you will do DNC? Please, the answer is not DNC, answer is suction evacuation, and it has to be very fast. Okay, then see, next treatment. Here not the story ends, here not the story ends. You have to ask the patient to get the follow up, because you know complete molar pregnancy has the 20% potential to change into malignancy. So you are going to call the patient back for beta hcg to see whether that beta hcg decreasing, or that beta hcg is becoming malignant, turning into malignancy, right? So you have to follow up the patient weekly till the beta hcg, three values of normal beta hcg. What is the normal value of beta hcg? Less than 1. And then once they are normal, then you have to call the patient monthly. So follow up for 6 months is must, to see whether their beta hcg is decreasing or not. 6 month follow up, 6 month contraception. 6 month contraception. See, question was asked in FMG. I don't in 2021, that serial beta HCG, बीटा एच सी जी सीरियल, सीरियल मीन्स बहुत बार, एक के बाद एक के बाद एक. लेट मी टेल यू द करेक्ट टर्म. Serial determination. Which of the following condition requires serial determination of HCG? Serial estimation of HCG. Beta, serial estimation of HCG means एक के बाद एक. See, what are the option? RH incompatibility. Which test we do in RH incompatibility? Indirect comb test. Why you mark there right? 26% of you are marking ki HCG, we get the HCG test done in RH incompatibility. Do we get it done? No, we get it done indirect comb test, ICT. Okay, then another option was viability of pregnancy. We have read in biochemical pregnancy only 2 times we are doing beta HCG there, and in this molar pregnancy, see, we are doing it till 6 months, weekly till 6 months. How many times? There are 4 weeks in a month. It means at least we are doing 20 times beta HCG. Okay, then gender identification, no, we don't do. 0% was there. So you are not going to mark for viability of pregnancy. For viability of pregnancy, we are doing beta HCG only 2 times, and for this molar pregnancy we are doing weekly 20 times we get the beta hcg test done. So when is more serial? In this molar pregnancy. So please, you are not going to mark it RH incompatibility. There we do indirect comb test, but we do it there we do serial estimation of indirect, we do indirect comb test. We are not doing hcg. Hcg is done in molar pregnancy. So evacuation is important, and follow up of beta hcg is important to see whether that complete mole has changed into malignancy or not. Then third thing is, because contraception is must, contraception is must, contraception is must. So why we want contraception? You tell me. Because pregnancy increases beta hcg. Now if this malignancy, it changes into if this complete mole changes into malignancy, then we will not come to know whether this complete mole is changing into malignancy or whether it is pregnancy's hcg. Because how we will come to know that it is changed by hcg, and hcg increase in pregnancy. So we don't want that if this patient change into malignancy, then we think that no, this is due to hcg, this is due to pregnancy, this hcg increase. So hcg increase during pregnancy, and hcg will also increase in this patient if it changes into malignancy. So we don't want to be confused with this pregnancy hcg. We want to see whether it is changing into malignancy or not. not want to confuse with pregnancy here. So we have to advise some contraception method. See, it was asked in NEET PG 22. Copper T is contraindicated copper T is contraindicated in trophoblastic diseases because uterus is soft. We can't put something inside it. It will perforate. So questions are asked. In December 21, it was asked serial beta HCG estimation was done in. See, on all the three steps question are asked continuously. They are asking suction evacuation is done or DNC is done in molar pregnancy. Suction evacuation is done. Then follow up beta HCG for 6 months is done in asked in FMG. Contraception on trophoblastic disease. Contraception, can we use copper T in trophoblastic disease? No. Uterus will perforate with copper T. Contraception is used. On all these three facts, question I have asked. It is highly susceptible that it will be asked to you people also in December. Please, whenever you tell the treatment of molar pregnancy, say these three lines. Follow up for of beta HCG for 6 months. Contraception by combined oral contraceptive. Say completely contraception by combined oral contraceptive for 6 months. Suction evacuation. Okay. Okay. Stop. Sorry for being getting harsh, but it is necessary. Okay. So once again, I would like to tell you, remind you about that patient which has come to us in the OPD. Patient has come that, ma'am, I'm having pregnancy, I'm having bleeding. We send that, we examine the patient and we send that patient for the ultrasound done. On ultrasound, no sperm appearance come. So we explained the patient that your two sperms got fertilized. Yes, and so now we have to do suction evacuation, follow up beta HCG for 6 months, and you have to use contraception for 6 months. Okay, so three things you have to keep in mind, and those snowstorm appearances are hydropic villi which have imbibed water. Okay. Okay, now you have to see, you have to you should be clear in your mind whether this patient is will change into choriocarcinoma or not. You know that partial mole does not change into choriocarcinoma, but it is possible that complete mole can change into malignancy in 20% of cases. So there are if these five factors are there, then there are high chances that it will turn into malignant. First is age more than 40 years. This was asked and many of you did it wrong, so I have to again emphasize on this slide. Age more than 40 years, beta HCG more than 10 raised to power 5, uterine size more than the gestational age, bilateral thecal uterine cyst, and slow decline in the beta HCG level. When you will follow up the beta HCG level, if you see a slow decline, so you have a suspicion that yeah, this patient there are increased chances that this patient will change into malignancy. Okay, so once again I will tell you the factors. Age more than 40 years, beta HCG more than 10 raised to power 5, if uterine size more than gestational size, bilateral thecal uterine cyst, and slow decline in the beta HCG level. Sometimes it has been asked in the past कि there are bilateral thecal uterine cyst, what is the treatment of it, because these thecal uterine cysts are due to the HCG only. HCG is stimulating, so their treatment is also suction evacuation. Okay, so not suction evacuation of these cysts, suction evacuation on the uterus. Remove the molar pregnancy, this cyst will also go. Okay, so they ask you in a different form, what is the treatment of bilateral thecal uterine cyst? So the treatment is not cystectomy or oophorectomy. The treatment is remove the molar pregnancy, because the etiology of this bilateral thecal uterine cyst is etiology of this bilateral thecal uterine cyst is Molar pregnancy. Remove molar pregnancy, HCG will go out. This thecal uterine cyst will get okay. Now see, vesicular mole means vesicular mole means complete mole or H mole. Again, I'm telling you one more question which got wrong yesterday in the yesterday's Telegram channel. The question was, yeah, question is, which of the following is not classified as GTN? GTN means neoplasia. Beta, neoplasia. Neoplasia में आप partial mole. Why you are marking the partial mole? Partial mole is not a neoplasia. Now neoplasia will start. Now we have end up with molar pregnancy. Now neoplasia will start. Okay, partial mole is not partial mole or complete mole. They are not neoplasia. They can change into neoplasia, but they are not neoplasia. So question was, which of the following is not classified as GTN? GTN means gestational trophoblastic neoplasia. Partial and complete mole, they are not neoplasia. They are abnormal molar pregnancies. They can change into neoplasia, but they are not neoplasia. Please correct this mistake. Which of the following is not classified as GTN? Question number 13 in the PYQ. Partial mole, invasive mole, choriocarcinoma, placental site trophoblastic tumor. So the answer to it is not classified. Partial mole, and you are telling that partial mole is a neoplasia. Partial mole and complete mole are molar pregnancies. They are not neoplasia. They can change. Okay, now these molar pregnancies, they can change into neoplasia. Even the normal delivery placenta can also change. Even the abortion can also change. So all of these three, not only the molar pregnancy can change into neoplasia, the normal delivery placenta can also change into. So even after the normal delivery, neoplasia can occur. Even after the abortion, neoplasia can occur. ठीक है, trophoblast can become abnormal and form. So in all these three conditions, not only the molar pregnancy change into gestational trophoblastic neoplasia, no, the vesicular mole also change into neoplasia. The abortion normal delivery placenta or trophoblast also change into neoplasia. The molar pregnancy abortion trophoblast also change into neoplasia. Okay. Now see here, this neo GTN or gestational trophoblastic neoplasia are these three conditions: choriocarcinoma, invasive mole, and placental site trophoblastic tumor. ठीक है, so gestational trophoblastic neoplasia has these three conditions. Choriocarcinoma, you all know. I know you all know. None of you mark their choriocarcinoma. The another condition is invasive mole, whose another name is chorioadenoma destruens. Okay, and the third is placental site trophoblastic tumor. Okay, these are the three conditions which comes in gestational trophoblastic neoplasia, not molar pregnancy and partial mole and complete mole. Okay, in choriocarcinoma, HCG increase and its treatment is chemotherapy. In invasive mole, all HCG increase and its treatment is surgery. And in placental site trophoblastic tumor, there is no increase in HCG and its treatment is, there is increase in HPL, human placental lactogen, and its treatment is also surgery. Okay. Some questions which are asked to you about the choriocarcinoma is, choriocarcinoma metastasize very fast. Okay, most commonly it metastasizes to lung. Okay, and because it metastasizes very fast, and very often you see on the lung metastasis, and it is seen by cannonball appearance, cannonballs in the lung x-ray, cannonballs on the x-ray are there, it means it is a choriocarcinoma. And when it metastasizes to lung, it is stage 3. Okay, it is stage 3, not the stage 4. Usually lungs metastasis we put in stage 4, but as it metastasizes very soon to lungs, so the staging has been kept 3, because there is good prognosis when it get metastasized to lung. And if in any case, for God's sake, it doesn't happen, if any normal delivery, after a normal vaginal delivery, or if after a normal delivery, any placenta get changed into GTN, then that is going to be a very bad prognosis. That becomes choriocarcinoma. So there is very, very bad prognosis. Okay, very, very, very bad prognosis. So you have to learn this. If the normal delivery is after normal delivery a patient gets choriocarcinoma, it means that this patient is going to have a very bad morbid condition. This choriocarcinoma is going to worsen. Or on this line, 3 times question have come in the past. Please focus on this line. If normal delivery, the placenta changes into choriocarcinoma, it has a very bad prognosis. Last slide. Chemotherapy. What chemotherapy we give in choriocarcinoma? If it is a low risk, is there is a WHO prognostic score. If it is less than 7, we give it we only give methotrexate. Chemotherapy, yes, of course, we give multiple doses of methotrexate. Along with it, methotrexate, we give it folinic acid. I know you, all of your pharma is very good, so you know that along with methotrexate, folinic acid is given. I know you, all of you know that. And if it is a high risk, that is if the WHO prognostic score is more than 7, then we have to give imaco. What is imaco? Etoposide, methotrexate, actinomycin, cyclophosphamide, oncovin. Right? So these 5 drugs, multiple agent, if score is more than 7. Okay? So if score is less than 7, then multiple doses of methotrexate. This is the same methotrexate we give in ectopic. In ectopic pregnancy, we are giving only a single shot. But here, we have to give multiple doses. Single agent methotrexate, multiple doses. Okay. That's all for the molar pregnancy. See you soon in the next video. Thank you.